Hey guys, this is Rob Greer, the CEO of SovDoc. I have my advisor here, Dr. James Chao, who's a very prominent plastic surgeon, hand surgeon, operating primarily out of San Diego. And then secondly, in Beverly Hills, where we are currently at Dr. Paul Nafz's practice. But we wanted to talk a little bit about what it means to be a sovereign doctor in today's environment and get a little bit of background from Dr. Chao, specifically within aesthetics, plastic surgery, and med spa, and kind of the evolution of that and where private equity comes into play there. I'll let Dr. Chao introduce himself because he's far more interesting than I am.
Rob, thank you very much for having me on the podcast. It's wonderful to meet again. We've crossed paths on so many different occasions. To see you bring up SovDoc warms my heart. I started down this pathway just being a doctor, my goal was to be a good doctor. And through hard work, we've been able to do that. But there's so many layers of complexity now, where you not only do you have to be a good doctor, but you also have to be a good businessman. So many things are coming into play, and to really try to understand that. And that's kind of why I'm here today. Obviously I've got a long background in academic medicine, where I learned a lot of the terms that are necessary, that the SovDocs, when they see your podcast and they see your book and your PDFs, will educate them. What is a balance sheet? What does EBITDA mean? All those.
That's a big one, EBITDA, right? Yeah.
Those things. So I think that's where I really want to get my colleagues out there, and for them to kind of get on equal playing field and understand what this new turn of events is, what's coming up for them.
Yeah. And so as a plastic surgeon, as a sovereign doctor, as a physician entrepreneur, how has been your experience operating a business, which is a practice, over the years since you started Prime?
Being in academic medicine, when I first started, I was put in charge of larger organizations. In fact, where I was at was really state organizations. So they're really like Fortune 500 companies in that sense. And then I was given a division to run and how to manage that. So you end up learning a lot of the terms from the CEOs and going to these administrative meetings that you have to wear as they call in academic medicine, it's the triple threat, but in reality, it's the quadruple threat. You have to do the academics, you have to do the teaching, you have to do the clinical, you have to do the research, and then lastly, you got to do the administrative aspects. So I learned a little bit and got an education there. And then when I went into private practice, I had the tools and understanding of what it meant to run a business, not just from a cottage industry, but really what larger organizations or Fortune 500 really are looking for, and then how to put them in the right buckets.
Yeah. And in many ways, I've been following your practice over years in the evolution, and you guys have been very active over the last few years with acquisitions and M&A, essentially doing what a private equity firm would otherwise do if they owned a platform within the aesthetic space. And so what you guys are doing is essentially what we want to help plastic surgeons and other doctors do, which is grow your practice as one, but then explore private equity transactions, whether it's minority, majority. So you guys are essentially doing without a private equity firm partner at the moment. Are you comfortable kind of elaborating on your strategy?
Yes, our strategy differs from a lot of the private equity that you've seen in medicine in general, where, larger companies are coming in and then acquiring doctors' practices. We're truly putting forth that term, sovereign doc. Our position is that at the end of the day, the doctor needs to have a level of autonomy. Yes, we have to work together. Yes, we have to apply by the basic business principles. That is like understanding the alphabet, and we're speaking the same language. But other than that, let the doctors be creative. Let them become a Shakespeare, write their poetry, get out there. But we have to have a common language. And so what I think our organization does is that we go in as physicians, and we're physician-led, and we're physician-strong, and we then get partners that understand that in terms of the docs. And this is where Sovereign Doc really comes in and helps us educate them without us going through the laborious aspects of doing this. So they're coming on board with that vocabulary, so that you can imagine going to medical school and not knowing the anatomy and the anatomy terms. Well, we're teaching them the anatomy terms of business.
Right. And that's precisely what we're trying to do. And we believe that doctors should be more savvy in the language of business, finance, and private equity by extension. Do you think they should be teaching those courses in medical school?
Absolutely. I think one of the largest trends that I see in my 28 years of medicine is, first, you had a lot of the physician scientists, such as myself, MD, PhDs. And then you had a number of people going to MDs and getting JDs. Now you're getting a lot of people that are getting the dual degrees that are MD, MBAs. Very, very common. And just because the business of medicine has gotten much more sophisticated, it's no longer, your wife's doing your books. There is actually an organizational aspect and also the compliance of HIPAA, various other things that could just tear your hair out in terms of that, and how to understand to do that in an efficient manner.
Yeah. And I know dozens of doctors at this point from my experience in healthcare private equity. And like anecdotally speaking, I'd say the one main common denominator amongst the most successful doctors, at least within business, is having that fluency in business and finance and private equity. So, and I'm sure you could attribute a lot of your success to that. And I'm sure a lot of your colleagues, it's the same as well.
Right. And then a lot of them also go, hey, look, it's gotten so complicated that I went to medical school. I didn't go to biz school. So sometimes they get lost in that. And again, being a sovereign doc doesn't mean that you have to get an MBA out of this. You just need to understand the vocabulary so that when they talk to you, it doesn't go over your head. So you can speak the same language. Whether you want to be the person crafting that language or writing that poetry or that prose of that business side, that's up to you. But you then have the knowledge of and command of that language.
Yeah, and I'm sure it was like a forced acquisition of that language. And, you kind of got your PhD in private equity because you interfaced with several PE firms over the years with various other ventures you're currently and were previously involved with. Are you, willing to kind of talk a little bit about some of your entrepreneurial investors in pursuits outside of Prime?
Yeah, actually, yeah. So again, they've all stemmed from what I call need. Still, despite the different startups and ventures that I've done, I'm still a practicing plastic surgeon. I still do about 400 cases a year type of deal. So on average, about 2 cases every working day, kind of a situation. And so I try to do that because I want to keep my pulse on what is happening, what I see the young doctors coming in at. What are their concerns? What are then the mid-level doctors doing that are in the prime of their career? And then what are the senior doctors doing? So what I call the rookie, the old pro, and then the people that are trying to scale, the scalers. So trying to figure out what they want. And so what I did was a couple of different areas that I found that there were stress points. One of the biggest stress points was doctors' offices. How do you compete with all of these larger organizations that have, ready MRIs, ready surgery centers, ready occupational centers when you're just kind of starting out? So I came up with a concept of a office co-sharing for medical. It's much like WeWorks, but just for doctors. And then we ended up creating not only a property company to own the real estate, but an operations company that knows how to then service those doctors. So just think about a hotel. You go to hotels, right? And you travel a lot. And you belong to a Hyatt or a club or a Regency or whatever it is. And that when you get there, you're a frequent flyer. They know which floor you like to be on. They know, which side of the bed you kind of sleep on. Well, this is the same way. So when a doctor comes into our office, we know if he or she is, for instance, a left-handed GYN doctor that needs a left-handed speculum, right? And so the idea here is that we then provide them for that. And those things that are extra or special are equivalent to your mini bar. If you open it, you use it. The stuff that every doctor needs, such as a robe, slippers, soap, that's all included in the package. So we set your offices up accordingly.
For some reason, I feel like this is going to be far more successful than WeWork did.
I hope so.
No, that's endlessly fascinating. And, obviously, medical office building as an asset class is in super high demand these days, very recession resilient. And the underlying tenets of doctor practices are quite strong as tenets, especially, not as relevant in aesthetics, but in many other doctor practices. The source of their revenue is the United States government, right? And CMS in many ways. So the visibility for the landlords like yourself to those rent payments on a monthly basis is pretty strong.
Correct. Yes, absolutely.
With Prime specifically, as the CEO, as the main operator, where do you anticipate and where would you like to see that platform go over the next few years? Like, what are kind of your key goals for that?
Well, I think it's really growth. Plastic surgery is a little bit late to the table. You've got orthopedics, ophthalmology, otolaryngology that have done this, and urology that have done this successfully, in this in particular, also dermatology. Plastic surgeons, we tend to be onesies and twosies. and we tend to be very high net worth earners. So it's hard to aggregate them together type of a deal. But I think with knowledge, again, from SoftDoc, they get the understanding, and PE is not to be feared, but really to be embraced, because I do believe that these practices ultimately will really have more genuine value than an insurance-based practice. So at Prime, we're only really doing aesthetic practices like Dr. Nassif's practice here. And so it's 100% aesthetics. And these practices are not related to government payments. So you charge a price equivalent to retail. So whatever the retail goes for, type of deal. So you can price fluctuate accordingly to the economy and what sells, what doesn't sell, as opposed to insurance-based. And if it's Medicare-based, it's declining at 4% per year type of.
And there's really strong business logic to kind of fusing these practices together. It's one of those instances where there's 1 + 1 = 3.
Oh, yeah, absolutely.
On many levels, right? From an operational standpoint, there's revenue synergies, but then there's cost synergies. You could kind of self-refer, if you're an open rhinoplasty and you're currently outsourcing your closed, you could bring that in-house, and it's very synergistic. Also on the cost side, you could start to bulk leverage for supplies with the Mentors of the world or other med device companies. But then also in the context of private equity, you get that multiple arbitrage where let's say a single physician practice in plastic surgery would go for low teens multiple. You start fusing them together, it's a broader EBITDA platform. It's a more strong platform. The private equity firm is going to see that as a really nice foundational asset. They're going to pay up in a big way. There's a nice arbitrage there.
Right. And then the value proposition from the physician side is giving them that level of autonomy. These are the areas that you still have decision-making capacity. So if you want to use a certain type of implant, you're supported to do so. If you want to do a certain type of procedure and you need a certain type of laser, you have now business people that will then talk to the laser companies, run your performance, say, hey, doc, this is something that you should probably get because your return on investment, your ROI is this many months, as opposed to another laser that you may like better because the salesman is a little bit slicker. You're going to get help that way. So you make good decision trees on what's going on. And then what is the useful life of that laser? How do you get your money back? What is the program, as opposed to typically doctors buy a laser because they think it works or the salesman has sold it and then decide to figure out how to use it, as opposed to in a business world, you run a pro forma, you do pre-sales, you test the market, you do all sorts of things leading up to the purchase of the laser. And at that point, you then go ahead and commit the laser, and then you are able then to track that, and you get to an end goal much better.
Yeah, and I think as it pertains to kind of physical CapEx that a CEO of a doctor practice is making, you might be going through the same calculus as well. It's, do I have visibility to the procedure demand and the patient demand to fill up this space? That piece of laser equipment, maybe you're 3xing the size of your practice. And so how do you guys think about digital patient acquisition or just patient acquisition in general? I mean, I'm sure it's one of those things where you have a really strong brand, so it's a gift that keeps on giving, but are you guys proactively doing anything on the digital side?
So what we're doing is a couple of things. We've chosen our model at Prime to be like the LVMH model, which is a house of brands. You have Louis Vuitton and they keep their branding, and you have Tiffany's, the blue box, they keep their branding. So Dr. Nassif here where we're sitting keeps his branding. The location in San Diego is different, but we all practice under one of the house, which is Prime Aesthetics Group type of deal. So it's, again, much like how Intel does their marketing. You could have various different computer companies such as HP or Acer doing their products, but at the end, your little ding dong powered by Intel. And that's how we get leverage as a group. And it gives us almost like an underwriter seal type of deal, that if you are Prime Doctor, you are Prime in terms of what's going on with that, and then they leverage, and then we also help them with their back end. So you talk about synergies, about purchasing. We definitely have those opportunities. Also expense control, because we don't have to have a bookkeeper in every one of the locations. Do that same thing with advertising. We have then one larger organization that oversees all the digital marketing and patient acquisition. So it is now no longer a competition between the two various different organizations that still keep their brand, there is now a flow or synergism beneath that, much like you have recommended, which is, okay, you have a practice that's strong in open rhinoplasty, but a patient wants it closed. Well, that doesn't walk out the door. That goes to somebody else within the organization. It could be across the street. It could be a different physical location. But at the end of the day, the funnel of cash and dollars comes down, and then the equity opportunity that the doctors participate in. It doesn't matter if you do the operation or your quote unquote partner who's in another practice does it. It all rolls into the overall company's consolidated.
Yeah, we could dedicate an entire podcast to digital infrastructure within the doctor practice setting, and we absolutely should when the time is right. But as it pertains to private equity specifically, I'm actually curious to get kind of your overall thoughts of private equity, even independent of plastic surgery, because, private equity is a little bit of a polarizing topic within healthcare. I think one thing we can agree on is that it's pretty dominant. It's going to be increasingly dominant as well. And obviously there are those edge cases of patient care and outcomes being sacrificed in the name of EBITDA and profitability. But obviously I'm an insider, I'm biased, but I have seen several instances of the right private equity firm that understands that a practice is a business, and as a result, a patient is a customer. It's good business to have good patient outcomes. And I think the right private equity firms know that, but I'm curious to hear your reaction to that. And
I think it's education. Obviously, it's education on both sides. So the private equity firm has to understand we're not all widget makers and we're cogs on a wheel. Plastic surgeon is a little bit different. There's a lot more expression, a lot of more artistry, and you have to give that doctor a little bit more free rein to do that. So it's that balance. The doctor, on the other hand, also has to understand that you just can't order every suture underneath the sun that you want because you're not paying for it anymore. You are paying for it because you are part of the company. You are part of all this. So it's not like you just sold your practice, but you then get to do whatever you want. No. It's a cooperation. So it's almost like a marriage, right? You may want to leave the toilet seat up, but your significant other, right, has a concern. So you work with it and you come back with it, right? So that's one of those things that I think you just have to understand the give and takes on both sides and that mutual respect. And how does that come? Really with education. And that's, again, where SovDoc comes in and gets those people prepared for all that. Private equity is here to stay. It is not going anywhere. In fact, in 5 to 10 years, the only way you're going to transition a practice is via a private equity type of transition.
That's accurate.
I think private practice, how we used to do it, where you're within 3 to 4 years of retiring, you bring on a junior person to start taking over, you introduce them for a year, he's kind of like an indentured servant for 1 or 2 years, then he then goes and buys your practice. And of course, it's one of those handshake deals. Nothing's really written. Nobody understands what they have to do. And then, well, that game is over, because if you look back in the last 3 to 5 years, those partnerships or those junior partnerships, 80% of them have dissolved. That's worse than the divorce rates that we have. They've dissolved, and basically, the only people that make the money are the lawyers, because you got two doctors that are slinging mud at each other. Type of situation. Let me just walk you through a simple scenario. So let's say a doctor is doing really well and is making a couple $1 million a year, okay? And let's say he wants to bring on a young doctor, Dr. Greer in this case, okay?
Yeah, maybe in another university.
But the idea is that, if that senior doctor treated you like a son and said, okay, I'm going to give you half the earnings that I make, and I will guarantee it for the next 5 years for you, $1 million a year, because I'm making 2, and we'll split it in half because we're partners from day one. Okay?
Where do I sign?
Right. You would say, where do you sign? But I would tell you, Rob, you will be broke because you will not be able to buy this guy's practice because
you don't have any equity too, right?
So the idea here is very simple. If I gave you $1 million a year for 5 years, that's basically $5 million in total. And let's say that I want to sell you my practice for the typical 1.5x EBITDA that goes. So you'd be $3 million.
I think you guys will get a lot more than that.
But I'm just saying but I'm just saying in a traditional old-fashioned transfer from a senior doctor to a junior doctor, it's 1x to 1.5x. Okay, so if I paid you $1 million, and let's say you practice in California, between Uncle Sam and Uncle Newsom, 50% of your numbers get washed away. So you're making $500,000 per year. Average medical student carries $600,000 to $700,000 in debt, of which they have to pay in 7 years. So it's about $100,000 per year. So now you're down to $400,000. If you took $400,000 times the 5 years, that would be $2 million.
Yes.
But you owe me $3 million. And that's without counting you where you're going to live, what are you going to eat, what are you going to drive, what kind of clothes you're going to wear.
Right. And what's the incentive of the senior plastic surgeon to even do that and give up some of the equity pool when they could go to a private equity firm and sell it for a double-digit multiple?
Right. Again,
it's very difficult to be coming out of med school right now, I think, in many ways.
Right. So I think that the numbers just don't work type of deal. And as you said, that would be a fantastic contract for a young doctor to get. The numbers are nowhere near that. So now imagine trying to make those numbers when you were guaranteed $1 million salary and you couldn't even make that.
All the more reason for, younger physicians to entertain starting their own practice at an earlier age. Obviously, it's easier said than done. You have the debt burden, and it's an easier launch pad to go work for a senior plastic surgeon before starting their own practice. But I mean, there are other examples I can cite. One of my close friends in Beverly Hills is doing that as well as a plastic surgeon right now in his early 30s, and he's phenomenally successful.
Yeah.
So it can be done. It
can be done. Then the question is once you do that and you're now senior, what do you do? How do you get the next guy to actually give you a number that is worth your 30 years? Again, looking at those numbers, if you're talking about from a point of view, if you were just to open a bar on the corner and for 30 years and run the bar successfully, there are many companies out there that would come in and buy your bar for a 5 or 6 multi.
You're the Coca-Cola plastic surgery at that.
Exactly.
Right. Brand value is incredible. Yeah.
And meanwhile, plastic surgeons, we have to go through so much more school, so much more training, so much more debt, so much more risk that we're only trading at a 1 or 1.5x. It doesn't make sense.
It doesn't make sense. Yeah.
Double digit with your private equity. And the reason why is because what we talked about, they amalgamate, they de-risk this, and there's a larger pool of money backing that up.
Double clicking on the intersection of plastic surgery and private equity, my thesis or hypothesis is that it's the consumerization of medicine, right? At a very high level, it's happening in the United States. Healthcare is eating the economy, private equity is eating healthcare, and aesthetics is eating healthcare in many ways as well. And the consumerization of healthcare is, consumer meets healthcare. You know this, obviously, they're just for the listeners. That's perfect within plastic surgery and med spa as well. The whole focus on cosmetics, the rise of TikTok and Instagram, exterior longevity is essentially aesthetics in a nutshell. And that's why private equity firms like it, because it's discretionary, it's elective, it's going to do well amongst, more affluent demographics for sure. But I'm just curious to hear your thoughts on, I guess, consumerization of medicine, and then also by extension, private equity in aesthetics.
Well, I think with consumerization of medicine, it's really very simple. It's not just the wealthy people can afford it more. You're actually lowering certain price points, and because you're treating it into a business or a sector of business, you can now push debt behind it. So consumer debt that goes behind that type of deal. So just like people get sold on fancy cars, that they like the certain car that they want to buy. So they'll do X, Y, and Z to get that car. And then a car loan company or a bank will give them that money to allow them to enjoy that sports car type of a deal, to be able to live their life the fullest. And this is really no different than that. In the past, it was only one company that did a lot of the healthcare financing. Now you have a broadening of those because you now have a consolidated business platform on the private equity back. So that doctor is not going to go flim-flam on you. The money is going to be safe. The operations that they're going to do are going to be tried and true, and not some half-baked operation that some artist decides that he or she wants to do. There is some level of control.
Yeah, and to an earlier point you made, obviously private equity has been prevalent within the orthopedic setting, the dental setting, ophthalmology over the years. It's interesting that it hasn't penetrated aesthetics as much, at least until recently. I think it was kind of at the tail end of COVID that private investors are starting to get very interested, because obviously there's a trough during COVID for a variety of reasons, but then a very big inflection point on the way back. And so specifically, I think med spa is further along with private equity than plastic. And I mean, obviously you might have your own opinions on that, but you're also very interested in med spa. Just curious to hear your thoughts on med spa broadly and kind of the private equity wave that's coming in right now.
Yeah, so med spas are ideal for private equity, and that's why you see a lot of more of those transactions. They're a little simpler in the sense of more along the lines of what dermatology has done, because there's very few dermatologists that have really names or brands, that type of deal. You got a couple, Dr. Pimple Popper and all that type of deal, but most of the time there tend to be 10 dermatologists kind of working together. While with plastic surgeons, there's not as many. There's usually one person or maybe two people, and by the time you get three people working, oh my God, that's a big group, type of deal. So I think that's just why I think plastic surgery has been slower. And the second issue is that I think private equity was a little bit scared and didn't understand the retail value, and they would rather get contracts. Oh, you have a great Blue Cross Blue Shield contract, and that's money in the bank, or a CMS contract or a Medicare contract. So that's a guaranteed level of payment. So if the doctor just continue to work hard, you get a level of payment,
right,
type of that you can bank and predict. While with cosmetic surgery, they were like, well, what happens with the economy? What's going on? But what happens is that it's still retail. Cars still sell. Makeup still sells during the recessionary issues. And I think med spa has also proven that.
Yeah. And I think, as it pertains to plastic surgery, I think suffice to say, we would both be very shocked if in 5 years' time, the percentage of plastic surgeons working for private equity firms or owned by private equity firms is not higher than it is now. And then on med spa, it's really interesting for me to witness what's happening right now, because a med spa in many ways is like it can be looked at like an e-commerce company, where the procedures, you can buy that on the website just like you could buy a health supplement company. I have firsthand experience that with my other company that's health supplements. So it's really interesting to see kind of how things will evolve over the next couple of years. But I guess this is probably something you would agree with. I think if you're a plastic surgery entrepreneur, and if you're the owner of med spa, oftentimes both, I think it'll pay to increase your fluency in private equity.
Oh, absolutely. I think they all go hand in hand. They're just different ends of the spectrum. One is non-invasive or minimally invasive, while the other one's invasive, but it still deals with the same continuum of patients and what their goals are, which is really, they want to look better. They want to look younger. They feel younger. So they want to look what they perceive that they want to do.
Yeah. And I wanted to pivot to a topic that I think everyone in the world is talking about right now, which is AI. And as the largest percentage of GDP by far, healthcare, and the intersection of healthcare and AI, I think is going to represent some of the biggest change we're seeing across the United States. For a glacially moving healthcare system, I think it's going to be quite disruptive, and there's going to be some dislocations happening. I think there's like so many areas. I would just love to hear your kind of overall thesis on AI within healthcare, and then we could kind of dive in.
I think healthcare and AI need to go hand in hand with this. And the reason why is this. The average medical knowledge, the half-life is 4 years. So think about this. By the time you start doing your anatomy class, which is your first year of medical school, by the time you finish medical school, the amount of information has passed. The half-life is 4 years. Okay. And that's going to continue to compress. So therefore, someone who's old like me, that's been in the business for 28 years, that's a lot of experience or knowledge. Now, AI will allow us to compress that knowledge base and, in a sense, do a Vulcan mind melt to retain that knowledge, that idiosyncrasies that I have. Why am I a better surgeon than the next doctor, or whatever it is? The way I look at things, and that can be then put into an algorithm that can continue to supersede you and your impressions of what's going on, so that you then have that opportunity. And then then it frees you up to learn more, and also your organization that you have. So you have then patient care coordinators and all that. All of that can be all packaged together into an AI situation where it's on demand. Sure, the doctor still needs to be involved, at the very end, because you still have to, check the AI or check the opportunities. I'm not saying that AI is going to replace it, but AI will get the information out in a much faster, quicker way, much more reliable way, and more consistent with what's going on.
And I think there's an ethical dilemma to embrace AI, because I think it's going to produce better patient outcomes. It's AI at its core enables mass personalization, and that applies to healthcare as well. Personalized medicine, real-time analytics, and honestly, real-time interventions. But yeah, no, it's really interesting.
That and health wearables, with the AI and the health wearables. So imagine if you could be monitored with one device. This other company that I
hopes, it's a fascinating one.
We have a health wearable where it's the size of a quarter, lasts 30 days, is paired with your cell phone and can do blood pressure, EKG, heart rate, pulse ox, and respiratory rate, and has a 9-axis gyroscope. And so it can tell you if you're falling down. It can tell you if you're sleeping or if you're snoring. It can tell you what your oxygenation rate is, all transmitted throughout.
Becoming cyborgs one day at a time.
Right, and it's all compliant and secure channel type of situation. And so that doctors can now monitor what's going on, much like how astronauts or troops are monitored. The Navy SEALs are monitored when they go onto missions and things like that, so that you get that personalization on that.
Yeah, and as a novice biohacker, I find this endlessly fascinating just to get your perspectives on it. And yeah, I mean, AI within healthcare, I think there's a broader biotech revolution that's happening that's not discussed quite as much. And I think also the acceleration of science with AI, particularly medical science. I mean, what's your base case by like 2030? Like, where do you think we're going to be from a healthcare standpoint?
I will be obsolete because
I think maybe all humans will be.
Medical students will be. I mean, just a case in point, it was interesting. My kids, when they were in 7th grade, they learned about DNA. And I was in my early 20s when I worked for Paul Berg, who won the Nobel Prize at Stanford, doing reverse transcriptase. Reverse transcriptase allowed us to clone DNA. And now my kids, when they were in the 7th grade, they were learning about that. So now imagine people getting PhDs and companies, multi-million-dollar companies that were started on that premise. And now a 7th grader basically is learning about that. So I see that in basically 10 years, what we are talking about today that's a given, right? Yeah. And again, when you talk about, the generation today, people that turn 21, they don't know what life is without a cell phone.
Right, it's just business as usual. Yeah.
So the thought of a landline and rotary dial is just not in existence. None of them have experienced that.
And in the first world, I think we have it pretty good. Like in the United States, we have our problems. I think everyone knows that, certainly within the healthcare system. But as compared to some second and third world countries, I think there's definitely a lot of room for improvement. But the beauty of AI, obviously, there's dystopian scenarios that the news media will endlessly talk about. But think about the implications of having an Albert Einstein in the pocket of every single child globally with an internet connection. And then also within healthcare, doctors like you in their pocket that's able to give them advice and give healthcare advice to normal individuals.
Right. And more than one language. I only speak 3 languages, and I can speak Swahili at that point and get that.
Yeah, I think speak is the key point too, right? There's a whole other topic, but I think the evolution of the interface between humans and computers is not going to be us sitting in front of a laptop and a phone very soon. It's going to be us interacting with it verbally, fluently. And that AI is going to know you and your medical history as better than you know yourself.
Yeah.
And it's going to produce.
It's already here, because I was on a Zoom call the other day, and as you see, I use my hands a lot when I talk, and they threw out expressions. I don't know how I turned that one on, but there was expressions going on. When I went to the thumbs up, then a little green light came on.
I mean, the reality is, we're in for a very interesting paradigm of AI generated content flooding social media. It's coming. The technology is here. Well, just to round it out, I think, this has been an extremely fascinating conversation. It's been great to pick your brain. And I was curious, any books, newsletters, any resources that you would recommend to sovereign doctors in general, I guess also like med school students that are coming out?
Well, I think the first thing you want to do is understand how a business person thinks, or the philosophy of business. It's kind of like glass is half full or half empty. So the doctor always goes and says, oh my God, this is a great idea, and rushes in with no idea of how he's going to leave. The businessman does the other way around.
Sure.
He goes, okay, this may be a great idea, but where's the exit? What do I look for? Type of deal. So that's what I've learned in my time interacting with businesses and all that is that you may have a great idea, but the shrewd business person looks at, okay, what does that idea look like, and what is the exit? So many times doctors just jump in and say, oh, I'll start a surgery center. Oh, I'm going to do this. Oh, I'll bring this laser on.
Right.
And they don't understand what that exit looks like. And then they're saddled with so many what I call handcuffs that prevent them from doing what they need to do. So I think the first way is a philosophy. You got to understand what the business philosophy is.
Right.
And then the second is I think any book, to get a primer on a book, and obviously what you've done with your papers and your ebooks with SolveDoc, really gives them a basic understanding of the vocabulary. What are some of these terms? The terms are not really hard to understand. If you can understand medicine, it's much more.
That's my point. You could absolutely do it if you invest the time.
Right.
And if you have the right resources, which I do think
Right.
are deficient right now. We're hoping to solve that.
And it's sort of like a businessman, if you just throw them a book of Gray's Anatomy, they don't know which way is up. But if you then walk them through and say, okay, here are some basic terms that you have to memorize because they're just definitions, and then let's build upon the definitions and how you use those definitions. And now it becomes a vocabulary. And pretty soon the vocabulary becomes sentences. And so this is the same concept. You just have to kind of put your doctor hat down for a second. And it's not like you're trying to study medicine where it's going to take you another 15 years to get to that point. We're talking about, a month or so, just kind of looking at it. And getting familiar with the language and understanding that, so you feel comfortable with that. And then you'll get the concepts. The concepts it's math.
Right. And this is a shameless plug for SolveDoc, but we do have a new ebook that came out, Private Equity 101 for Doctors. We have obviously this podcast and a newsletter. We're a new company, but we're starting to grow pretty quickly. So if you're interested, please feel free to check that out on our website or our Instagram. But final question for you. Let's, imagine you're coming out of med school right now. Maybe not when you were coming out of med school, but let's hypothetically say it's today. What do you do? What is your advice for those people?
Oh, I think the answer is really pretty straightforward. Be a good doctor, do what you love to do. That's the first thing. Then the second thing is get back to your roots, which is just about all the doctors, they all come from well-rounded educations, but they just spent their last 4 years really focused in on the medicine. Get out there, see what the world is like, and apply what you do. Because at the end of the day, doctors are a social animal. They are there to help society. And if you are devoid of the society, you don't know that there was an earthquake in Iceland 2 weeks ago, you're not being a good doctor.
Right.
You just have to, and that goes with the business concepts as well, because business, you deal with business every single day of your life. You're running your household, you're running, you're deciding what kind of car loan to get, what kind of house loan to get. These are all things of your life. And so if you just incorporate that into your practice of your medicine and make sure that that is a good thing and understanding, because if you're a good doctor but you run a poor business, you're not going to go too far, and you're really not helping, again, society.
Right.
So it takes both.
Right. And yeah, Dr. Chao, I really appreciate you carving out the time, your valuable time, especially coming from a very long flight overseas. Something tells me that this won't be our last time having a conversation on the podcast, especially in light of your evolving role with SolveDoc, but really appreciate it. I hope this is beneficial for other sovereign doctors out there. And if you're liking what we're talking about, please feel free to follow us. This is all we'll be talking about going forward every single week.
All right. Well,
Thanks a lot.
Thank you for having me on the show.
Beautiful.
Thank you.
Thank you.